Hello, my name is Robin. I'm going to be your student nurse for the day, and your doctor has given an order for an NG tube. So I'm going to insert that, okay? And we're also going to start a feeding. So can you verify your name and date of birth? Name and date of birth for me, please. Okay. All right. I'm going to perform hand hygiene real quick. All right. I'm going to put this little drape on here just in case you get anything on there so don't get on your gown. Alright, perform hand hygiene again. Put on clean gloves. Remove my supplies. Alright, first I'm going to measure the NG2. I'm going to start at the tip of the nose to the ear, and from the ear to the xiphoid process. I'm going to mark that with a little piece of tape. Alright, I'm going to get my lubricant, do 3 to 4 inches. Okay, alright. You'll put your chin down. I have a cup of ice. I'm going to have some water. I'm going to get you to swallow while we're doing this to help it go on down. Alright, I'm going to chin down, grab a cup of water, tell the patient to swallow if they're able to. Insert in. Alright, once I reach the spot that I marked with the tape, I'm going to temporarily secure. Temporarily secure it. And then I'm going to take my syringe and I'm going to aspirate just a little bit of contents for a pH check. I'm gonna put it on my pH strip. I'm looking for less than 4 pH. Okay, then I'm going to clamp the NG tube and send the patient off for chest x-ray. Once the patient returns and placement is verified, I'm going to more securely tape the NG tube to my patient. Alright, then I'm going to flush in 10 mils of air, unclamp my tube, flush 10 mils of air to account for the pH draw. I'm going to then take my water and I'm going to get 30 mils and flush 30 mils of water into the NG tube. Then I'm going to begin the tube feeding as prescribed. So if it's a gravity, there's 3 different types. There's gravity, bolus, and pump. For a gravity, it's just like kind of like a free feeding where the gravity is, pulling the feed to the patient. For a bolus is when there's a prescribed amount of feed for the patient to receive, and a pump is more of like when it's 10 mils per hour, 20 mils, 30 mils per hour, like a prescribed amount of feeding, and that's usually determined among the residual amount that we pull, which we have prescribed residual checks for patients that are receiving tube feeding. The NG tube will also be connected to suction. So now that I have my patient attached to the suction and feeding as prescribed, I am going to remove my glove, or I'm going to remove this from below. I'm going to remove my gloves, wash my hands, pretend this is a sink and soap, wash my hands, and I'm going to document the size, how the patient tolerated it, as well as which nair the tube was inserted. And done.
Okay, good.
Hello, my name is Robin. I have a doctor's order here to remove your NG tube. All right, can I get your name and date of birth, please? And make sure the head of the bed is in half hours. All right, I'm gonna do some hand hygiene. I already have a towel here that will collect anything. All right, I'm going to tell the patient to put their chin down and hold their breath while I remove. All right, I'm gonna dispose this in a biohazard bag. Okay, I'm gonna get my swabs and I'm gonna do my nasal and oral hygiene and just clean up. Clean up and make you feel better. I'm gonna do one each time. Okay, I'm gonna remove the towel. I'm gonna ask the patient how they feel. Remove my gloves, do hand hygiene, and document what I just did, which nose, and how the patient tolerated it.